And as promised, back with another edition of Family Health Experts on this Local 6 Midday, entertaining Dr. Jared Anderson of Audiology and Hearing Center, answering your questions at 1-888-208-6946. And we have a question from Mark who wants to know, how long should my hearing aid battery last?
Yes, depending on the battery size, the duration can differ. The smaller batteries, they tend to last 3 to 4 days. Some of the larger batteries, they tend to last 5 to 7 days. If you're not quite getting that long out of your battery life, try opening the battery door each night. That's going to turn the battery off, the hearing aid off, so it's not going to be constantly draining all night long. One option that a lot of people are going to now too is the rechargeable option. That way you just put it in a charger each night, and then in the morning you wake up, it's ready to be worn all day. You don't ever have to worry about changing a battery.
I have a question from Etta, who has an issue with, I'm not sure if it's tinnitus or tinnitus, but however you pronounce it, it's the ringing in your ears. And anyway, she wants to know, can a hearing aid help that go away?
Yes. Tinnitus or tinnitus, either pronunciation is correct. Hearing aids, they don't cure that. However, many patients do get relief from their tinnitus with hearing aids. Now, the level of relief, that does vary from patient to patient, but many of my patients that have a hearing loss and tinnitus, an appropriately fit hearing aid, that gives them relief. Other patients, if that tinnitus is still bothersome, I can add in a tinnitus masking program. It's a second program the patient can activate or deactivate at their convenience, adds in a little bit of white noise, a soothing melody. That way the patient has other sounds to focus on, that tinnitus isn't so bothersome.
Paula has a question, and she wants to know, do I need a new hearing test to get fitted for a hearing aid?
Depending on when the last hearing test was, in Kentucky you do need a hearing test within 90 days of prior to being fit with a hearing aid. This is so that, when we go to program a hearing aid, we want to make sure that, it's fit, appropriately, accurately for that hearing loss. That's going to really make sure that, patients are getting the best benefit.
Got a question from an anonymous viewer who says, what exactly should I expect at my hearing aid evaluation? Evidently, this is something new. They want to know what they should expect.
Right, understandable. At a hearing evaluation, the first thing I do is I sit down with a patient, any family member or companion that comes in with them. I'm looking at where that patient's having trouble hearing, what they're doing in those situations, and what their goals are. After that, then we do a diagnostic hearing evaluation. It's a painless test. Here we're looking at how they're hearing at each frequency, how they're doing in, understanding sentences, certain words. After that, I know the severity of the hearing loss. I also know the type of the hearing loss. I review these results with the patient. Then we figure out a plan. So we're looking at, what options are available for them, what works for their hearing loss, also what works for their lifestyle.
Got about 30 seconds left and time to squeeze in a question from Margaret, who says, I'm interested in hearing aids, but I want to make sure that they work. Do you have a hearing aid trial?
We do. So in Kentucky, you do need a minimum of a 30-day period. However, at Audiology and Hearing Center, we do have a 75-day period. The longer a patient has an untreated hearing loss, the longer it takes for them to adapt to that hearing aid. Hearing aids, they're a rehabilitative process. So that 75 days, that gives us plenty of time to, patients to adapt to that sound. That way they can feel comfortable and confident in their investment.
Dr. Jared Anderson of Audiology and Hearing Center has been our guest on this edition of Family Health Experts.